What's in your water and what isn't? The question for Madison residents after the utility department announced it will no longer add fluoride to city water. The discussion follows a March proposal to the City Water and Wastewater Board. And it's getting some pushback. While some suggest the addition of fluoride has negative effects on our health, many dentists point to scientifically proven benefits for your teeth. Fox 54's Caleb Aguayo takes us to see what's happening with your water.
A glass of water? You might want to know what's in it or what's being taken out of it. Madison Utilities proposed back in March to take fluoride out of the drinking water, and the Board for Water and Wastewater Management unanimously approved that motion on Friday. The change is set to take effect on June 16th, and local dentists tell me that change could have negative effects on children's dental health.
Other than asthma, tooth decay is one of the most common chronic childhood diseases that kids face. By kindergarten, over 50% of kids will have already had a cavity. So it's something that affects every socioeconomic status. It doesn't matter, where you live. Tooth decay is a rampant problem, and by taking the fluoride out, we're only going to be in more of an issue.
As a pediatric dentist, Dr. Grisham says without fluoride in the water, cavities in kids will only become more common. That means more chronic pain as more strain is placed on an already encumbered medical system.
Surgery centers, hospitals, and ways that we can anesthetize and offer safe ways to treat these cavities, it's going to put a huge public health strain on our ability to care for kids.
Limestone County treats its own water without fluoride and buys fluoridated water from Huntsville and Decatur, distributing it to parts of the county. CEO Daryl Williamson says it comes down to the costs associated with adding it to the water. Although it's cheap to buy, fluoride corrodes the treatment facility and can be harmful to the people mixing it.
It becomes more about an operational view of what you have to do at your water treatment facilities in order to inject fluoride, and the safety of your operators that are injecting that, and then your pumps and various things there. I think by and large all those decisions at the local level are made for operational concerns and not part of any agenda.
The man who made the proposal, Water Manager David Moore, sent us the following statement echoing similar sentiments. The decision was made in consideration of employee health and safety, structural degradation of treatment facilities, and the ongoing maintenance costs associated with the use of hydrofluorosilicic acid. He clarified, naturally occurring fluoride will stay in the water supply. They're only stopping the addition of extra fluoride. Athens, Decatur, and Huntsville all say they have no plans to remove fluoride from their water supplies at this time. In Madison, I'm Caleb Aguayo, Fox 54 News.
So how do you know if the water flowing to your tap is fluoridated? It's easy to find out. We've put a link in the story on our website, fox54.com. Just select your county, then the utility that supplies your water. The page will tell you if fluoride is added to the supply and in some cases, how much.